Happy Tuesday, everybody. So today I wanted to talk about what is a biomechanics assessment, what actually happens when I do one, why would you want to do this, what does it do, what's the point, what is it? So I'm going to just explain a little bit about what it is and why we would use it. So listen in if you're interested. So my name's Sarah Jane. I am a healthcare professional, I'm a podiatrist and a physical therapist and Pilates teacher. And I'm here in the yoga Pilates place in Glasgow. And one of the big things that I do quite a lot when I'm working with people is I perform some assessments. So they usually come, patients usually come and see me because they've got a bit of pain. They've usually got pain somewhere in their body. So the patient today who, after many assessments, she went for biomechanics assessment, was in quite a bit of pain, and we have given her a diagnosis of tibialis posterior dysfunction. Anyway, so I would use a biomechanics assessment to assess a problem that you may be having. So say you're maybe out running and you're getting a pain or you keep getting an injury or whatever that is, then we want to get to the bottom of that and actually be able to then best treat you. And your treatment plan really is totally unique to you. And that treatment will more than likely be some rehab. Usually that's always first line. And research shows that rehabilitation is always the best practice, so we'd always start there. And sometimes it can be the use of orthotics if that's indicated, and many other things. So there's lots of different things that can be done depending on your presentation and what we're going to do. But let's talk a wee bit about what we do in here. So the first thing that's happening when you book a biomechanics assessment, as soon as you come through the door, I'm assessing you. I'm assessing how you move, walk, function, and actually seeing you in motion really tells me loads about you. So that's the first thing I'm doing. I'm watching you from the moment you come in. Full thorough history is taken. So it's important. Your history actually is to be honest, the most important part, to be honest. So a thorough history, thorough, full medical, full background, exactly what's happened, past surgeries, really in-depth history, because that will help anybody that's treating anybody be able to give them the best support that they need. Now, the other thing that I would do then is I would take you into my clinic room and I would perform appropriate assessments. Now that would usually, obviously this is a bit of a sweeping statement because it really does depend, but usually that would involve some assessments where you're seated. So we'd call them open chain assessments. So we would do joint assessments. So I'd be looking at things like the motion in your joints, so how much your joints move, and Mummy, I'm the only one watching. That's the story of my life, girls. You're not the only one watching, but thank you for watching. Hopefully other people will watch too, girls. I don't know who it is. Is it you, Emmy? Is it you, Lily? My kids are on watching. At least they're interested. So we would perform some assessments. So we'd have you on the plinth and we would perform some joint range of motion assessments. So how is the joint moving? And that will tell us a few things. So for example, I had a patient in today who had pain on her left and quite acute pain. This, in the end, we've got some dysfunction in tib post. And yeah, she was getting a few bits of pain in that foot and she had some restricted motion in some of her joints. So we're assessing that. We also then do a motor assessment, and that would be just checking muscle power strength. Obviously you've walked in here, that's assessing that as well. Neurological assessment as well. Now depending on what your health history is, that assessment could also be very different. So for example, it's Emmy, Mummy. Hello Emmy. Hope you're enjoying this and seeing Mummy's eating a cracker and it's stuck in the back of her throat. So depending on your medical history and what you are coming in with will really depend on where those assessments go. So the patient I had in today for her biomechanics assessment actually involved doing a sensory test as well on her, doing checking for peripheral neuropathy because of the type of presentation that she was describing and some of her other medical history there as well. So that warranted me to then do further assessment, which in the end turned out to be absolutely fine, but it's always better to check. So the assessments really do depend on what you need. So I couldn't say to you that this is exactly what will happen because it does depend on each individual. But know that it's a thorough assessment, and then from there we would then get you moving. So In my clinic, I use a system called the PodoSmart system. So I've brought it over to show you. So this is what it comes in. So it's the PodoSmart gait analysis system. Now, if I'm being honest, do I really need this? And the honest answer is no. I don't really need it. I could simply use an image capturing and slow the motion down to watch it. Actually, I love just watching. I get so much information just from watching. However, what I really like about the PodoSmart gait analysis system is that it gives you it all very visually, and it's great for patient education. So they can see in black and white and colour exactly what I'm talking about. So I like it. And it also has some other really cool features in it that are quite handy. So for example, today for this patient, it was showing that she was using more hip flexors than her glutes. So that then encouraged me to do more assessments throughout her hips and her pelvis and looking at her pelvic stability. So from that perspective, it's good. But if I'm being honest, it's not something that's absolutely needed. So if you do gait analysis and assessments, it's not really going to give you any more information if you're adequately trained and you're good at doing that, but it is very good for patient education and compliance, and then obviously your patient outcomes from there. So when you open up the box, it comes with all lots of fun things. So let me show you. So there's a little computer that basically picks up all the data. So this is a little computer that comes with the system, and essentially I have a web-based software on my work computer that links up with that. So I hope that makes sense. Now, then what we do is we use these digital insoles. Now, these are connected to the system via Bluetooth. So essentially, we charge them via a little USB charger, I'd imagine. Very good at knowing exactly what these USB and whatever are, but essentially, we charge them up. They charge last ages in these actually. And the system allows us to do a gait analysis based on that patient's needs. So if it was a runner and there was something happening when they were running, then we'd obviously want to recreate what that is. So doing a walking analysis isn't necessarily going to give the information that we would require. So the assessment again depends on the individual. And also if you're using a treadmill, now we could use a treadmill in here, but again, how you walk and how you run is different on a treadmill to how it would be road running. And what I love about these is that I can give you these. You come in, put them in your shoes, and I can send you outside for a run. And when you come back in, the system actually just picks up that data via Bluetooth, and I get that data that way. Bye, Amy. Bye. So essentially whether we're doing a walking gait analysis or whether we're doing a gait analysis on the treadmill or whether it's sending you outside. So I really love that. So for anybody, actually any other health professionals, it's quite handy for that. So that's the system that we use in here. And as I said, is it, if I'm being honest, is absolutely needed? No. But what I do love about it is again that patient engagement and that education. So when I come in, or when patients come in and see me in clinic, a big part of what I'm trying to do is almost help them understand what's actually happening in their own body. So it's a big kind of educational thing as well, because unless I get them to comply and actually do the rehabilitation or do whatever it is that I'm asking them to do, then I'm not going to solve that problem for them. I'm not going to help them. So I've got to help and inspire them and get them on board to actually be able to get a result. I hope that makes sense. So I really like the PodoSmart system for that patient education, so that they can really see. So when I'm talking about different phases of gait, when I'm talking about different points of contact, it's kind of like in colour and a diagram for them that makes it a lot easier to understand, and it's just quite pretty. So that's essentially the system that we use. Now from there, so for example, this patient I had in today, I will see her in about 4 weeks' time. She doesn't need orthotics. There was no need for that on this occasion. However, that's not to say that the orthotics wouldn't be indicated. Somebody using the hairdryer at a later date or even sooner. So I could have prescribed her orthotics today to get her over the hump of the pain that she's in. However, first line will always be rehab, and rehab will always get the tissue where it needs to go. That tissue is responding because it's been loaded in a particular way. And for that particular patient, it involved her strengthening tissue. She needed to strengthen a particular tissue, tibialis posterior to be exact. And I could use an orthotic, almost like using it like taking painkillers to help her just while she's rehabbing that. So that's one indication of that. However, in discussion with the patient, we discuss that. Do we want to do that? Do we not? Let's try rehab. However, that door is always open. So if say for example next week she was feeling, actually that is pretty sore, I want a wee bit of a helping hand along with my research, along with my rehab, then I could do that. So I hope that makes sense. So everybody's management is different, and know that I will not just always prescribe an orthotic as first line. I absolutely won't. I will discuss the options with you, and you're always with my guidance and control of your treatment plan. So rehab first line, and that's kind of where we went with that today. So I hope that kind of gives you a wee bit of an insight into that. Now, our rehab program's in here, what we do with that, because when you're in and we show you the exercises that you're going to do, as soon as you've left, you've probably forgotten them, haven't you? So what we do is we use our online, we've videoed a lot of, well, we've videoed loads, thousands of videos to be honest over the years, on specific rehab that we use. We also have a big catalogue of rehab exercises. So when we are seeing patients, every patient, their rehab will be sent to them individually, and it's not just a printed out bit of paper, it is sent to them via their online digital programme. And that programme is basically there, they follow it, we can see when they've logged in, if they've not, blah, blah, blah. But they give us permission to see their data, they don't need to let us see that if they don't want to. But essentially in there, it lets them connect up with videos, feedback in, and any issues, any red flags, we can see that as well, and we can then get them in and help them along with that if need be. But it's great because it's all video and instruction and written word as well. So it means that you're not having to remember all of whatever exercise, whatever rehab you've been given. It's all there anytime, and we've got a wee app and you can access it via the app. It's pretty easy to use. So that's generally what happens as the outcome of seeing us for a biomechanical assessment. Rehab's always going to be involved unless there's a reason it's not, but 9 out of 10 times it will be. And then obviously once we open back up, a lot of our patients come in here. I'm actually standing in the studio reformer room just now. We're obviously closed for classes just now, hopefully September for them. But a lot of our patients come in and do a lot of body work and rehab, reformer work, Pilates work, yoga work with us here in the studio. And that's why it works so well, because the rehabilitation, actually the first thing that you do in Pilates on the reformer is footwork. One of the main reasons that I get interested in podiatry was my work that I did starting as a Pilates teacher, and that link with the biomechanics and the footwork. So most of the things that you will be doing within the TYPP in Glasgow, you will be rehabbing your feet, starting from there, starting with those strong foundations that then go straight up your whole kinetic chain. So hope that just answers maybe some questions on biomechanics. How would that work? If you are in pain, if you are getting knee pain, hip pain, back pain, sometimes, not always, but sometimes having a biomechanics assessment can really help you. It certainly can help us give you the best advice and the most thorough assessment. You can book in with us for physical therapy and get some manual therapy, massage therapy, sports massage. Of course, that's there. However, if you've got something and you really want to get to the bottom of it and find out, actually, I'd like to know what's going on and have a wee bit more time to explore, then a biomechanical assessment is always a great way to start. The number of patients that I get in, they might just come in for a routine podiatry appointment, and a lot of the pathologies that they're getting, a lot of the issues that they're getting, whether it be even just something as simple as a build-up of callus, right? they might be coming in and they're simply getting something managed, like they're getting annoyance of hard skin, corns callus on their skin, and that tissue is adapting that way because it's getting too much pressure onto that. There's too much force pressure going onto that point of the tissue, and it's doing that for a reason. And for many of them, we would be able to sort that with a little bit of just looking and advice to help them manage that. So just kind of managing the symptom really goes against the grain for me. So for me, it's about digging deep and actually, well, why is that there in the first place? Now, I'll be the first to say that for many people, there may not be a way of correcting that. If you've got a fixed deformity, if there's changes there that can't be fixed, then it's about managing that in other ways. That does not mean that rehab is not always the panacea to fixing everything, but there usually is a lot that can be done with research, that with rehab that many people wouldn't even have thought about. And especially as we get older, your feet really show your health of your overall, to be honest, your overall body, from your vascular system, your cardiovascular system, your nervous system, to how everything's working, to keeping you on your feet, to keeping your balance, that proprioceptive feedback, knowing where you are in the space. As we age, that changes. And as podiatrists, one of our big roles is keeping people on their feet, keeping them healthy, and reducing that kind of, I suppose, falls prevention. And it's sometimes quite frustrating because you get people in and you say, I wish I'd seen you just a little bit earlier, a wee bit sooner, and it's always the same. People don't really come and see you until there's a problem. And I get that, but yeah, it can sometimes be a wee bit frustrating. But generally, there are always things that can be done to make you a bit stronger, a bit better, keep you on your feet longer. But as I said, most people don't come in until it is too late. So don't be that. So if you need any help, any advice, or you're looking for more information and biomechanical assessments with us here, then just reach out, pop us a DM, comment on this, send us an email to hello@typp.co.uk. You can get all our information on our website, which is just www.typp.co.uk. The clinic's busy today. And yeah, just reach out. So if you have any questions, don't hesitate to just get in touch, comment, send a private message, whatever you need to do. I'll see you all later.